Okay, give me 1 second here. Okay, if we're all ready, I'll start going. We're gonna spend a little bit of time in a few minutes going through a weekly surveillance report, as we always do. Before we did that, I want to make sure that I'm doing what I can to communicate some sort of broad messages. As of this week, at least 250,000 Americans have died after being diagnosed with COVID-19. 250,000 people now during the year 2020. That's likely an underestimate. We've had more than 560 deaths in Montana so far, a number that is growing more rapidly as we move into the winter. And nearly 500 Montanans are currently in the hospital fighting the disease. In Gallatin, we have just under 900 active cases. We're averaging roughly 160 cases a day. As of yesterday, we had 26 in the hospital. About 30% of those are typically in critical care at this point in time. Critical care, also known as intensive care. And we're seeing staffing shortages impacting the hospital and impacting schools, the health department, other government agencies due to not only the disease, but quarantines related to the disease. And just in general, people being less willing to be out and about and being pretty careful about what they're doing. The White House has a weekly summary every week that they provide to the different states. The one for Montana this week talked about the national picture right now, and the quote that they used is that we're seeing, quote, aggressive, unrelenting, expanding community spread throughout the nation. And they note that transmission can be greatly reduced by the things that we've been talking about for a long time: keeping our distance by avoiding crowds and crowded settings, using face coverings when you're in public, washing your hands, and staying home when you're sick. Right now, the risk of contracting and spreading the disease is as high as it's ever been in Gallatin County, just because we have more cases, we have more disease in the county than we ever have during this surge. That risk is only going to rise as we move through the winter, unless we can come together and do the things that help us limit the spread of the disease. We can do this. What does that mean? That means staying away from crowds and crowded settings, including parties, bars, anywhere people cannot easily distance from others. Wearing face coverings whenever you're out in public, especially in indoor settings, but really think about it almost anywhere you are when you're out in public. And remember, think of it as a simple common courtesy to those around you, kind of like covering your sneeze. Those masks don't just protect you, they protect those people around you. And the people who are wearing it for you. Honor that and return the favor. Staying home when you're sick is really important. When you have symptoms, it's really important that you stay home and that you take care of yourself. And with this virus, it's very difficult, but even when you don't feel sick, know that you might still be spreading the virus and act accordingly. That's why the face covering is so important. It's a source control method. It helps protect those around you. Even though you might not be feeling sick, it's important to protect those around you by doing simple things, simple, inexpensive things like wearing a face covering. The other simple, inexpensive thing you can do is wash your hands with soap, and do that frequently, and do that thoroughly on a regular basis. And take care of yourself. Eat healthy foods, get plenty of sleep, get your flu shot. Those are things we can do to take care of ourselves, to protect those around us, and to take some load off of our healthcare system by avoiding getting not only COVID-19, but influenza and other things. As we're less than a week from Thanksgiving, there's some things that I think are really important to stress. as we're planning for that holiday, it's one of everybody's favorite. Please keep gathering small. Think about really just having your household people with you. Find ways to be with others virtually. Keep those groups small. Consider those who are most at risk, the elderly, people with underlying health conditions, chronic diseases, and find ways to celebrate with them at a distance. We don't want these holidays to become a bad memory for families. But we know, looking at what we've seen locally, what we see in the literature, that those social settings, especially indoor social settings, can be really risky during the pandemic. We are getting close to a path out of this. We may have a vaccine as soon as next month, but it's going to be several months before we can get it provided to the population in general. And the things we're doing now are really important, are going to lessen the number of people who are in the hospital, the number of people who have to die as we go through that process. And do whatever you can to avoid bringing the virus home to those you love. If you do have to travel, if you're a student going back home, if you're a student coming back to Gallatin County, doing the things that you can do now to minimize your exposure, certainly staying out of bars, staying out of parties, staying away from others, staying home, wearing that mask. And if you have symptoms, you got to stay where you are. Please don't travel. Please don't take that home with you. I know we're all tired. I know this is hard. Excuse me. I know we're all tired. I know this is hard, but we can do this. And what we do now will help determine what the next few months is going to be like. With that, I'm going to share my screen and walk you through some of our most recent data. Bear with me for a moment. Y'all see that? Okay, same drill as in the past. We'll go through this in a stepwise fashion. We're continuing to see a really high number of cases. We were up to 140, a little over 140 cases per day on a 7-day rolling average per 100,000 residents. That's up 5% from where we were last week at this time. We've had, as you all know, we've had some days that are just enormous number of cases, approaching or exceeding 300 cases a day on some days. Our percent positive continues to be at above 20%, 22.8% to be specific. Both these areas, both in cases per day and percent positive, we're talking about being 4 and 5 times higher rates than what we want to see. Ideally, we really would like to see this positivity rate below 5%. And that, according to the literature and a model that Harvard University uses, public health school uses, is you really would like to see the number of cases per 100,000 at 25, that you really consider that a tipping point. So we have blown through that. We just have really rapid, widespread, significant spread of the disease in Gallatin County, and people need to understand that virtually anywhere they go, they may be at risk of contracting or spreading the disease. Testing is really a concern right now. We're seeing the median time from specimen collection to report to public health is rising. During the period of time, November 1st to November 16th, that period of time was 4 days. That's twice what we'd like to see. It's a little bit less when you look at the month-long figure that we've been looking at before. I think it's about 3 days, but more recently we've seen that taking a median time of 4 days. That's a problem for a number of reasons. It's a problem because the people who are getting tested need to wait longer before they get a result. That keeps people out of schools, that keeps staff out of schools, out of the hospital. It means we're living with that uncertainty for a longer period of time. It also makes our contact tracing less effective. And when people don't know whether they have the disease, they're more likely to spread it. And so this is a significant concern, this early in the year. You can see that it really is highly variable how many days it's taking to get test results back. Last week, as you recall, the most common number of days was one that people were waiting. And this week, the most common number of days is 5. But you continue to see pretty widespread dispersion. It really is pretty variable. These ones that are 0 are probably antigen tests that are happening at 1 or 2 urgent cares that we have here in town that are really rapid. They come back within 15 or 30 minutes. Just really concerning that our testing system is being stretched at this point in time. We continue, again, this is a little bit misleading. We continue to get cases entered. We continue to do all we can to get in touch with new cases, but the number of cases that we have means we're very constrained in terms of being able to go much past that. We are trying to find close contacts who are more likely to be in high-risk settings like nursing homes or hospitals or schools, congregate living settings. But with the high number of cases that we've had, it's becoming more difficult to do that. And sometimes we just struggle to even get the cases entered to track the overall spread of the disease. I think it's important that we're honest with the community about that. While we continue to work really hard, no one's given up. We continue to get those cases entered so that we can track the level of spread. We're really not been able to contain, and frankly, the rate of spread and the breadth of the spread, this is to a point where contact tracing is less effective, and what is more effective are those community measures. The community really taking responsibility to do the things that keep a distance and limit spread. This is our onset date. Over time, again, as I remind you that it's not really a downward trend we're seeing at the far right-hand side. That's really related to the fact that we haven't yet been able to do those initial interviews to fill in those onset dates. We continue to see a substantial number of people getting sick and reporting symptoms and getting tested. Continue to see substantial rise, particularly in the 20-something age category, but no age category is really immune to it. As you get older, the rate of rise tends to be less steep. I think that's a reflection of people probably being more careful, being home, maybe being able to be home. As you get younger, people tend to need to make a living, maybe in more social settings than we're used to as you get older. MSU, we continue to see growth there, not quite as rapid as what we saw last week. Also been in discussions with them. They're seeing an easing in the pressure on their housing situation there. And they're getting really close to the end of their term, and more people will be leaving town, and there'll be fewer people on campus, although there will still be people on campus. And you can see the list of active cases in schools in Gallatin County. This is just a snapshot in time. This changes every day, every hour of every day, really. And you can see we're seeing multiple cases in a number of schools. Many schools have cases. We've had a couple of schools here in Bozeman, in Belgrade, in like Anderson School have elected to go remote for a period of time, in some cases past the Thanksgiving break, mainly related to staffing issues and being able to have the staff to be able to run the schools. Being able to find substitutes, paraprofessionals, and teachers, frankly. And then, we're in ongoing communication with Bozeman Health. This really changes on a regular basis. Bozeman Health is going to be working on providing some of this information on a 7-day rolling average. They continue to see pretty significant numbers of people, of COVID patients, both in the critical care beds and non-critical care beds. They continue to manage that, and they continue to tell us that they currently have capacity, but their staffing is a real issue. I am concerned that we focus on beds, and in doing so, we miss that they're the people behind providing the care that are in those beds are pretty stretched and pretty stressed right now. So with that, I'm happy to take questions if there's questions out there.
This is Aaron Bolton with Montana Public Radio. Just wanted to ask about testing capacity for close contacts. We've seen other counties mention this week that their ability to get those close contacts tested is strained. How is that capacity in Gallatin County?
Yeah, our capacity for asymptomatic close contacts is also constrained. And what we're really seeing a constraint on is people who are asymptomatic who want testing because they want to travel or because they're just they have a need to know before they go somewhere whether or not they're positive. If a close contact develops symptoms, we're sending them in for testing. If a close contact is in a sensitive setting, we're continuing to send them in for testing. But there are times when we make the determination based on testing availability that sending in a close contact might not make a lot of sense right at that moment. For instance, if somebody is a close contact and they just recently have been a close contact, it may not make a lot of sense to send them to the test site right away. And we'll advise them to really monitor, stay home, continue to stay home, monitor themselves for symptoms, put in those orders. But it is a concern here, and there are limitations overall in asymptomatic testing. We're not saying don't get tested if you're a close contact, but I know that Bozeman Health has made a decision that they're really limiting their ability to test asymptomatic folks who are not close contacts is pretty limited right now. Other questions?
Hi, Matt. It's Perrin from the Chronicle.
Perrin.
Hi, Matt. You said that kind of at this point, the most effective things that can be done are the more community-minded measures like wearing masks and stuff. But obviously, as you know, there's still people who aren't following the rules. After all this time, kind of what is your advice and suggestion for getting the people who are still not compliant with those guidelines to comply?
Nope. I want to start out, first of all, by recognizing, there's been some coverage. I'll just acknowledge there's been some coverage in the newspaper and elsewhere of a small number of establishments that are not in compliance. I'm going to talk about that in a minute. I want to recognize the vast majority of restaurants and bars that are complying and are going to great effort and expense to do so. I think it's important that we acknowledge that and we honor that and we appreciate that and we support that. I'd also want to recognize that since the Gallatin City County Board of Health passed its rule 2 weeks ago, limiting bar time to 10 p.m., putting a 50% capacity limit on gyms and bars and restaurants and certain other settings, and putting a limit on overall group size. Since the local board did that, we've seen the state of Montana implement a very similar rule, as well as the state of North Dakota, for the same reasons we did, because the virus is spreading rapidly and it's unrelenting, and it is having an impact on hospitals, and we're heading into the holidays. And so those rules are important. They're an important part, not an entirety, but a part of our ability to help the public to understand the behaviors and the stuff that people do that spread the disease. For the small number of establishments that are not in compliance, we're working with the county attorney to make sure that those establishments understand that they're not in compliance in a very formal way and how they can come into compliance. And I remain hopeful and open to the idea that we can get them to come into compliance. But I'm also realistic, and I'm also determined to continue to work with the county attorney and law enforcement to administer and enforce the local board rule. And that can take a number of forms, including citation. Local law enforcement agencies have the ability to write citations, and they can contact the county attorney for how to do that. The other issue that I don't want to get into too deeply is there is the potential that we seek through civil litigation a judgment to compel compliance. All of those things are on the table and should be on the table. And we're determined to do what we can to enforce the rule that the board passed, the health officer order, as well as the statewide directive. Those all contain very similar requirements on bars and restaurants. But we need help from the community. We need you to stay, if you're out there, you know that being in a bar after, or a restaurant after 10 p.m., that bar is operating out of step with the rules illegally. We need you to stay out of those settings. Look, we have a decision to make as a community about what's important. Is it important to limit spread, to keep schools open, to support the doctors and nurses in our hospital who are putting all on the line, to protect seniors in nursing homes and long-term care? Is that what we're trying to do to limit spread in our community? Or is it important to have people in bars late night or in other social settings like parties at any time they want? And that's kind of the choice we're facing right now. It's not pleasant. I know it's hard. But I want to acknowledge the vast majority of restaurants and bars that are complying and are working hard, and be careful about castigating all of them. Urging those who are out there, even those who don't feel safe about going to a restaurant because they have a underlying health condition, or because of their age, or because of some other factor, just because of the disease that's out there in the community, to order carry out, to order delivery, to continue to patronize those restaurants who are operating responsibly. So bottom line is we're pushing ahead to administer and enforce the board rule, the local health officer order, and the state directive. And we're really looking to be supportive. And I would note that in providing the state directive this week, the governor provided some funding to support those organizations that are in compliance, to support the employees of organizations that are in compliance. And I'm hopeful that that may entice others, the small number who are not in compliance, to be in compliance. But if not, we'll push forward and seek to compel compliance. Other questions?
Matt, yeah, I have another question. You obviously every week, present these statistics that are getting worse and worse. I was just wondering at this point, kind of, what is your biggest priority or biggest concern?
There's I'd have to pick one, Perrin.
You can pick a few, I guess, but I just things that you're monitoring most closely at this point or are particularly worried will be getting worse in coming weeks.
The constraints in our testing system make it difficult in a lot of different ways. It makes it difficult to identify cases. It makes it difficult for people who are waiting for test results. It makes it difficult on organizations who need to get staff back, and if they know they're not COVID positive, that are able to do that. That's a big deal. And I'm pretty worried about that. And I'm pretty worried that as we get into flu season, we really haven't had influenza hit our community in a meaningful way yet. And so once we get that happening, we'll have more people with symptoms who will be seeking testing, and that's likely to put even more constraints on it. So that's one. And then I think the other one is as we head into the holidays, the mixing that goes on, and we're social creatures. That's our biological, sociological impulses are to pull people together. And that is counterproductive to what we're trying to do to limit spread. And so it really worries me as we're moving into what is usually a wonderful time of the year. I hate the idea of it becoming a time when, people will identify with their families getting sick or somebody in their family falling ill and ending up in the hospital. And I don't want to be a doomsayer, because I think we can do this. I think there's ways to do this. We can have virtual Thanksgivings, and we can celebrate with ourselves, and we can celebrate the fact that we might have a vaccine soon, but we're not there yet. And even when that vaccine lands, it's going to be several months before we get enough of it, and before we figure out distribution, which is going to be very challenging. So I think there's a lot to be thankful of as we head into next week. But there's going to be even more to be thankful of if we can take care of each other and really think carefully about how we treat each other and what we do. Other questions?
Hey, Matt, I just wanted to confirm, does the county's health order take precedence over the governor's order that goes into effect today?
Whichever is more, if the governor's order is more strict in areas, the governor's directive takes precedence.
Okay.
They're very close though, and if you've read both, there's not a lot of daylight between the two of them, so there shouldn't be too much conflict. But if we cannot be less strict at the local level than the state directive is.
Okay.
We can be more strict, but I don't think that's really the case in the case of these. It really, there's not much daylight between the state directive and the local rule. Okay, if there's no other questions, I want to express appreciation. We probably won't do a press conference next week. We'll try to get the surveillance report out next week at this time. I'm hoping that people will be getting a little bit of downtime, and maybe we'll do something either right before or maybe more likely coming out of the Thanksgiving weekend. We'll be available if people need to get in touch with me or something big happens, but I'm thinking we probably won't do a press conference next Friday. Okay, thank you all. Have a good holiday and take care.